Did you know that more than 9,500 people in the United States are diagnosed with skin cancer every single day? But here's what most people are not paying attention to. Skin cancer often starts with minor changes that are easy to overlook. Every year, millions of people ignore these early warning signs, leading to late-stage diagnoses and even life-threatening complications. Do you know that recent studies have shown that the skin cancer incidence rate increases with age, and men are 10% more likely to develop melanoma skin cancer than women, and are 4% more likely to die from melanoma than women? According to the National Cancer Institute, early detection can lead to a 99% survival rate for melanoma, the deadliest form of skin cancer.
A stage 1 melanoma has a cure rate of about 95%. So if you catch it early, that's great. A thicker melanoma is something that is still in the skin but has not spread to the lymph nodes or the rest of the body. Still has a pretty high chance of cure of catching it early, somewhere in the range of 70 to 80% chance of cure.
What's even more important is that many of early signs of skin cancer can appear in places you would never expect, like under your nails or on your scalp. In the next few minutes, I am going to share with you 8 early signs of skin cancer that could help you catch it before it spreads. These are not the common get a mole checked tips you have probably heard before. They are the hidden and often ignored clues your skin is giving you. Most people shrug them off as harmless, but spotting them early can truly save your life. And let me be clear, this is not just another use sunscreen and hope for the best conversation. We'll be focusing on warning signs supported by scientific research that dermatologists emphasize but many people fail to notice. Research reveals that there is an overall low skin cancer knowledge among different categories of individuals. Stay tuned, because this isn't about scaring you unnecessarily. It's about empowering you to protect yourself and your loved ones. By the end of this video, you'll know exactly what to look for and how to act. But before we continue, this content is provided for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider with any questions about your health or medical condition. Do not disregard professional advice or delay seeking it because of something you have read here. Now, let's dive in. 1. A new or changing mole.
Top 3 signs of skin cancer to look out for are areas of skin which are changing in size, changing in shape, or changing in color. These 3 signs together will identify many skin growths. Cancer is a changing phenomenon.
One of the earliest and most overlooked signs of skin cancer is the appearance of a new mole, or changes in an existing one. While benign moles tend to remain stable in size, color, and shape, suspicious moles often show asymmetry, irregular borders, uneven coloration, or rapid growth. Skin cancer begins when UV radiation damages the DNA of skin cells, causing mutations in genes that control cell division and growth. In melanoma, the most aggressive form of skin cancer, these mutations lead to uncontrolled growth of melanocytes, the pigment-producing cells. This results in the formation of irregular, atypical moles. Ignoring these changes can allow melanoma to penetrate deeper layers of skin and spread to lymph nodes or other organs. If caught early, melanoma has a 99% survival rate. However, once it spreads, survival rates drop significantly. If you notice a mole that fits the ABCDE criteria, that is, asymmetry, irregular borders, uneven color, diameter over 6 mm, or evolving, consult a dermatologist immediately. Early intervention can save lives. 2. Persistent itching or tenderness. Localized itching or tenderness that doesn't resolve can be an early indicator of skin cancer. Unlike temporary irritation caused by dryness or allergies, this sensation is often confined to a specific area and worsens over time. Growing skin cancer cells, such as in basal cell carcinoma or squamous cell carcinoma, release inflammatory chemicals called cytokines. These molecules irritate nerve endings, causing sensations of persistent itching or pain. In some cases, the tumor presses against nerves, intensifying the discomfort. According to research, history of severe sunburns prior to age 10 is reported as a risk factor for developing melanoma in later age. Left unchecked, cancers causing these symptoms can invade deeper skin layers, affecting surrounding tissues, and even spreading to other parts of the body. Persistent itching or tenderness, especially when accompanied by visible skin changes, is a red flag requiring immediate medical evaluation. By addressing this symptom early, you can prevent progression to more advanced, harder-to-treat stages of skin cancer. 3. Non-healing sores or ulcers. A sore or ulcer that doesn't heal after several weeks is a critical early warning sign of skin cancer. Unlike minor injuries, these lesions may persist, bleed, or reopen repeatedly despite care. Skin cancers, particularly squamous cell carcinoma, interfere with normal healing processes by invading healthy tissue and producing enzymes that break down collagen and other structural proteins. These cancers also hijack nearby blood vessels to sustain their growth, depriving surrounding tissue of essential nutrients for repair. Ignoring non-healing sores allows the cancer to grow and potentially spread to lymph nodes or other areas. In advanced stages, treatment options may be limited, and the risk of complications increases significantly. If you notice a sore that doesn't heal or keeps recurring, seek a dermatologist's opinion. Early treatment can prevent the cancer from spreading and improve long-term outcomes. Before we move on, if you are looking to dive deeper into the early indicators of cancer, be sure to subscribe to the QuickTime newsletter linked below. Each week, we share expert-backed tips, delicious recipes, and actionable steps to help you reduce weight and feel your best delivered right to your inbox. 4. Red or scaly patches. One of the ignored early signs of skin cancer is the appearance of persistent red or scaly patches on the skin. While dry skin or eczema often improves with moisturizers or topical treatments, these patches may remain unchanged or worsen over time.
Squamous cell carcinomas occasionally show up as patches of the skin. Occasionally they will show up as sort of bloody bumps on the skin. They may sometimes hurt, occasionally the area may itch, sometimes there may be minimal burning sensation.
In squamous cell carcinoma, cancerous keratinocytes proliferate in the epidermis, disrupting normal skin cell turnover. This leads to thickened, inflamed patches that appear red, flaky, or rough to the touch. The inflammation is further amplified by the immune system's response to abnormal cells. If left untreated, these patches can grow larger and invade deeper tissues, eventually spreading to nearby lymph nodes or organs. Advanced squamous cell carcinoma can cause disfigurement and require more aggressive treatments, such as surgery or radiation. If you notice a persistent red or scaly patch that doesn't improve with routine care, consult a dermatologist promptly. Early detection can prevent progression and lead to more successful treatment outcomes. 5. Dark streaks. Under the nails. A lesser-known but significant sign of skin cancer, particularly melanoma, is the appearance of dark streaks under the fingernails or toenails. These streaks may look like bruises but do not fade over time and can gradually widen or darken. According to a research, subungual melanoma occurs when melanocytes beneath the nail bed become cancerous due to genetic mutations or UV exposure. These cells produce excess melanin, leading to pigmented streaks. As the cancer progresses, it may cause the nail to lift or become deformed. Ignoring this sign can allow the melanoma to spread to nearby tissues or even metastasize to distant organs. Advanced stages of subungual melanoma are much harder to treat and have poorer survival rates. If you notice a dark streak that persists or changes, especially if it occurs without trauma, seek medical evaluation immediately. Early diagnosis significantly improves treatment success. 6. Pearly or waxy bumps. Another early sign of skin cancer, particularly basal cell carcinoma, is the appearance of pearly or waxy bumps. These bumps are often flesh-colored, pink, or white, and may resemble small pimples that don't heal. In basal cell carcinoma, abnormal basal cells grow uncontrollably, forming raised lesions. These cells often cluster around newly formed blood vessels, giving the bumps a shiny or translucent appearance. Over time, these bumps may ulcerate or develop visible blood vessels. While BCC rarely spreads to other parts of the body, ignoring these bumps can result in extensive local tissue damage, scarring, and disfigurement. Advanced cases may require surgery, including reconstructive procedures. If you notice a bump that doesn't heal or changes in appearance, it's essential to seek medical advice. Treating BCC early can minimize damage and ensure effective management. 7. Pigmented spots that keep growing. An early and often overlooked sign of skin cancer, especially melanoma, is a pigmented spot that continues to grow over time. These spots may look like freckles or age spots, but gradually expand in size or darken in color. Melanoma develops when melanocytes, the cells responsible for skin pigmentation, mutate and begin dividing uncontrollably. These cells accumulate excess melanin, leading to the formation of dark spots. As the cancer grows, it invades surrounding tissues and disrupts normal skin architecture, causing the spot to enlarge and change shape. If ignored, a growing pigmented spot can signify advanced melanoma, which has a high potential to metastasize to internal organs such as the lungs or liver. Once melanoma spreads, survival rates drop drastically, making early detection critical. If you observe a dark spot that enlarges or changes in shape, color, or texture, it's vital to have it examined by a dermatologist. Early diagnosis and treatment can significantly improve outcomes. 8. Persistent skin thickening or lumps. Skin thickening or lumps that don't resolve are often early signs of skin cancer, particularly in rarer forms like Merkel cell carcinoma or squamous cell carcinoma. These areas may feel firm to the touch and can sometimes grow rapidly. In Merkel cell carcinoma, neuroendocrine cells in the skin proliferate uncontrollably due to mutations, often linked to UV exposure or a weakened immune system. Similarly, in squamous cell carcinoma, keratinocyte growth causes localized thickening or lump formation. These tumors infiltrate surrounding tissue, creating firm, raised areas on the skin. Ignoring thickened areas or lumps can allow cancer to spread into deeper tissues, including nerves and blood vessels. Advanced cases may lead to extensive tissue destruction or metastasis, requiring aggressive treatment like surgery or radiation. If you feel a lump or notice thickened skin that persists for weeks or continues to grow, seek medical advice promptly. Early treatment can prevent complications and increase the likelihood of successful outcomes.